This is Dr. Safira Costa, and today's session will be on PCOD or polycystic ovarian disease. Now, PCOS and PCOD are very similar. PCOS is polycystic ovarian syndrome. Although similar, there is a difference. Polycystic ovarian syndrome is more related to the metabolic disorders or other imbalances, whereas PCOD is more related to the hormonal imbalances. In this video, I've used both the terms interchangeably. Now, as some of you must be aware, September is the month dedicated to PCOD awareness. PCOD is a very common metabolic and hormonal disorder that occurs in females in their reproductive age. So, it can occur anytime between menarche right up to menopause. According to WHO, around 10% of the female population have or rather suffer from PCOD. That means out of 10 females, 1 female will be having PCOD during her reproductive life. And according to AIMS, 20 to 25% of Indian females of the childbearing age suffer from PCOD. PCOD is also the cause of infertility in 20% of the cases. The sad part is, according to statistics, there is a progressive growth in the incidence rate of PCOD, which means there is rapid increase in the new cases of PCOD that are detected, and this is caused due to unhealthy lifestyles and increase in stress. But the sad thing is, very few females or the population in general are aware about what PCOD really is, and hence they cannot help themselves to overcome this disease and they suffer all their life. Now, we'll cover this topic in 2 parts. In the part 1 video, we will cover about what exactly is PCOD, what are the causes of PCOD, what are the symptoms of PCOD, what are the long-term risks or rather the complications of PCOD, and the diagnosis of PCOD, or when can we see. The part 2 video of this session will deal more with the management of PCOD. So we will have the dietary management, that is what exactly should your diet be when you're suffering from PCOD. Okay, the exercise that is required to overcome PCOD, and also the homeopathic management of PCOD. Or we will see how homeopathy can help treat PCOD and hence enable the female to lead a healthy, productive and happy life. Now, what exactly is this PCOD or rather polycystic ovarian disease? Now, it may be a long big word, but once broken down, it is very easy for us to understand what exactly this disease is. So we take the word polycystic. Now, poly, as you know, means many or multiple. Okay, so poly is many and cystic. Okay, now this cystic refers to cysts. Cysts are nothing but sacs filled with fluid. Okay, they are bag-like structures which is filled with fluid. So many cysts, polycystic ovarian. So where are these many cysts? Polycystic ovarian disease. So many cysts in the ovaries is causing this disease. Now, what do these cysts do in the ovaries? These cysts are benign cysts, that means they are non-cancerous, but these cysts produce androgens. Now, androgens are known as male hormones. So when these male hormones are produced in the female body in larger quantities, what happens is that it causes an imbalance in the hormones. And this imbalance in the hormones is what gives rise to all the issues. To understand polycystic ovarian disease better, I will try to explain it to you in the form of 2 diagrams. In the first diagram, I will show you a normal ovary and what exactly goes on inside it. And in the second ovary, I will show you a polycystic ovary and what exactly happens over there and what exactly causes the problem. Now, if you have watched my previous videos on menstrual health and hygiene, I have explained over there how all the follicles are present in the female's body right at birth. Now, these follicles are in the most immature form And after puberty, every month one follicle matures and grows into a full-fledged Graafian follicle, and at that time that follicle will burst and the ova will be released into the uterus. Now we'll see what exactly happens inside a normal ovary. Okay? Now here we have an immature follicle. Okay? And after puberty, what happens is this one follicle will start maturing. And it will keep maturing. So this is the same follicle that is maturing. Okay? And it will keep maturing till it forms a Graafian follicle. Once it forms a Graafian follicle, it will burst out and release the ovum in a process known as ovulation. Okay? Once this ovum is released into the uterus, the remaining particles of the follicle will continue to disintegrate till the process is complete. So this whole thing will take place in one cycle. Now once this one cycle is complete, the whole process will start all over again. So another immature follicle will start maturing till it forms a Graafian follicle, that is the fully matured follicle. It will rupture, an ovum will be released, which will be taken up into the uterus, and the remaining particles of that Graafian follicle will continue to disintegrate, will form the corpus luteum, and once this whole process is done, again the cycle will start, and this whole process is repeated every month. Now what will happen in a polycystic ovary? Okay, this is the ovary, and now here again we are having the same immature follicle. Okay, that follicle will start maturing, but the maturation of this follicle will stop midway. It will not complete its fate of maturing into a Graafian follicle and bursting open in the process of ovulation to release an ovum. The maturation of this follicle gets stagnated over here and it forms a cyst-like structure. Okay, since this follicle cannot go any further, what happens is that the process starts all over again. Okay, so another follicle starts maturing, and again after it reaches a certain point of maturity, it stops its growth. Again, the fate of this follicle will be the same. It will remain as it is in the form of a cyst. So, since this follicle as well cannot complete its journey of ovulation, the process starts again. And this continuous process will cause the formation of many cyst-like structures. These cysts are nothing but the fluid-filled sacs we spoke about, and the clustering of all the cysts will form what we call a polycystic ovary, and hence that female with these ovaries will be suffering from PCOD or polycystic ovarian disease.